All right, it's 1 minute after 2 o'clock in the afternoon. So good afternoon to everybody and welcome. I am Pramod Dwivedi, Health Director at Linn County Public Health. Today, we are here to provide an update on COVID-19, particularly from the perspective of our healthcare partners. COVID-19 and the Delta variant are increasingly burdening our community and healthcare system. COVID-19 cases in Linn County has increased significantly in the past 5 weeks or so. Of all reported cases of COVID-19 so far this month, 83% are of the highly transmissible Delta variant. Additionally, since August 1, we have lost 9 of our neighbors. Last month, for all of the July, there was 1 COVID-19 death in Linn County. Even 1 death is too many. But if we get vaccinated and follow our layered preventive measures, we may avoid infections, hospitalizations, and deaths. As of yesterday, about 55% of our entire Linn County population is fully vaccinated, and a little over 64% of individuals who are eligible have been fully vaccinated. As we all know, vaccines are effective at protecting against severe illness and death, and at high enough community vaccination levels can prevent viruses from spreading within the community. We are asking our neighbors to do your part in preventing the spread of the virus. We are here to support our area hospital partners. They wanted to come to the community today and let people know what's going on in their facilities and warn the community that the cases are increasing, which is impacting healthcare capacity. Remember, protecting public health is a team sport. It's all about partnership. Our hospitals are our critical partners, and you, our neighbors, are also our critical partners. We are most certainly tired of the virus, but the virus is not tired of us. So we must work together and let's beat the virus. Please, let's get vaccinated and follow all the mitigation strategies, including face covering. All right, with that, let me introduce today's speakers. Dr. Dustin Arnold, Chief Medical Officer, Unity Point Health, Cedar Rapids. Dr. Tony Myers, Chief Medical Officer, Mercy, Cedar Rapids. And my own colleague, Heather Medder, Clinical Services Supervisor here at Linn County Public Health. But first, Dr. Arnold.
Thank you. As said, the COVID cases have increased in the preceding 2 weeks at a pace that if this continues, it will trigger both hospitals to initiate contingencies to redirect resources to take care of COVID patients, as we did last fall and even in the spring of 2020. Redirecting those contingencies and those resources to care for patients will assure that everyone that needs critical care will get critical care, but it will come at the expense of routine and preventative health care. And we've seen some of that building up over the year. Care that was delayed in 2020 is starting to become cases in 2021. So we want to prevent that scenario. Vaccination is a key. Vaccines work, they're safe, they prevent hospitalizations and death. And now with the FDA approval of the Pfizer vaccine, it is approved for use in 16 years and older, and there continues to be emergency authorization for 12 to 15. Because what we're seeing at the hospital here is largely unvaccinated individuals admitted to the hospital. On Friday of last week, it was about a 17% were vaccinated of patients admitted to the hospital. So that leaves over 80% unvaccinated. And as Pramod had indicated, it is more than likely the Delta variant that is generating these cases. They tend to be a little bit younger in their young to me, in the 40s, and unvaccinated. So vaccines are prudent and safe and effective, and please consider choosing to be vaccinated. Other mitigation factors that I would recommend also, as indicated by Pramod, is to wear a mask and social distance, particularly indoors, whether you're vaccinated or unvaccinated, particularly in scenarios where the air doesn't circulate as well as it should, and then avoid large groups even if they're on the outside. If we continue to be diligent and we continue to push that vaccine rate for the community up, 63% is a good number. I'm proud of the community, but I'd like to see that closer to 90. And with that recommendation, I turn to my good friend, Dr. Meyer, to talk about what Mercy has seen in terms of volumes similar to ours, but also had beat us the last 2 days. Not that Tony and I are competing against each other. Tony?
Thanks, Dr. Arnold. A lot of this is going to be somewhat similar, but I'm going to get down into the weeds a little bit. So I'm going to talk down through a few specific topics. I'm going to go over census stuff, capacity stuff, talk a little bit about staffing, talk a little bit about what's different this time compared to last November when we faced our biggest surge. And I don't know if people remember or really knew at the time, but we were under incredible pressure last November, and I'm 100% certain that the community helped pull us out of that, in addition to all the incredible work that was done by the medical staff. But I'm going to kind of compare to where we are now versus November and then in the spring. And just, like I said, talk through some differences, talk about a little bit of modeling about what I would expect is going to happen. But then there's a big ask, and in order for the scenario that I'm going to lay out to happen, I need the community's help. So starting with the big thank you again to the community, I think we get focused on some of the negatives. There's a lot of negative out there, but there is no question in my mind that there is a large majority of the community that not only responds to a direction from public health, but actually notices things on their own. Starts to pay attention to what's going on in surrounding states, starts to maybe rethink some gatherings, rethink masking a little bit, more hand hygiene. I know that that's already happening, and it has happened in the past, and the community's response is critical and will continue to be critical moving forward to deal with this and protect the healthcare system so that we can protect you. The other big thank you is to the healthcare workers. And again, we are in a different spot now. There are many healthcare workers that went through the last year and kind of decided to do other things. So our pool of healthcare workers is slightly smaller, and that's a concern moving forward. But the ones that we have continue to step up, takes extra shifts, focus on the patients, focus on safety. And it's just across the board, everybody is working harder, and everybody's frustrated and burnt out from this pandemic. But I'm just amazed every day that they keep going, and they'll take care of Linn County. I agree with Dr. Arnold. We will get it done, but we do need the county's help, the community's help in helping turn what's going on right now. So from a census standpoint, we have 33 in the hospital right now at Mercy, and it's one of the first times ever we have more than Unity Point. So I'm not happy with that, Dr. Arnold. But compared to June and July, where we had an average of 1 to 4 patients on any given day, we have 33 now. So that's just a marked increase compared to last November. At Mercy, we had a couple of weeks where we were really under a lot of pressure, where we were taking care of the mid-50s of patients, but that was only for a couple of weeks. And I'm sure that the community helped us turn the corner at that time too. From a capacity standpoint, we had gone back essentially to normal operations in in June and July. And compared to when we were really surging hard in November, we had 2 floors of the hospital that were dedicated to COVID. And unfortunately, we had to move our pediatric unit over the weekend and rededicate an entire floor to COVID this past weekend. So we don't have a problem with beds. We don't have a problem with ventilators. We don't have a problem with medication. Our PPE is okay. We're watching all that stuff close. Medications, really it comes down to staffing and the pressure on the staff. And again, it's up and down the line. It's respiratory therapists, nurses, environmental people, food and nutrition, everything is just being pushed. And Dr. Arnold didn't mention this, but the other thing that's going on right now, which is different than last November, is we're just seeing more sick people. And I think Dr. Arnold would suggest some of that is because of delayed care, which he's probably right, over the last year. And we're having increased hospitalizations for all sorts of other things. And we have COVID layered on top of that. Again, it's putting incredible pressure on the staff. What's different otherwise? There's a couple of things too that are different about this. One is it's the Delta and it's clearly more infectious. The other thing that's different in a positive way is that a lot of Linn County is vaccinated. Thank you so much, because we would really be in trouble if we didn't have that 60+% vaccinated right now. We are also seeing younger people. 7 of our hospitalized patients are in their 30s or 40s. We are seeing more breakthrough, and this is concerning. So from January till June, 95% of our admitted patients were unvaccinated. This changed dramatically over just a short period of time at Mercy. Over a period of a week and a half, we went from 15% of people admitted were fully vaccinated to 35% today. Now, that doesn't mean that there's no benefit in the vaccine, obviously. The people that are getting admitted are, for the most part, less ill than they would have been. And by far, a clear majority of our critically ill patients are still unvaccinated. But I want all the people that are vaccinated out there to realize they are still at significant risk. And so we need to tighten up with some mitigation, but I'll talk about that in a second. So I'm going to talk about kids real quick. Our capacity for children in the hospital is generally much smaller than adults, and it's important for the community to understand that that's a nationwide thing. Children just don't go to the hospital that often. So our capacities at both hospitals is something that we're working on. We've been working on that for the last couple of weeks because we're seeing increase in a respiratory infection called RSV, which can lead to especially small children needing oxygen for a few days. And so that's who's filling up our pediatric unit right now. It's not COVID-19 patients, although we've seen a few of those. The kids are clearly getting this Delta much easier than they did the original. But they're also tolerating it for the most part very well. It's mostly mild illness and don't require admission. But a few of them are getting sick. So we are watching that pediatric capacity very closely. And I have conversations with Dr. Arnold about that as well. Okay, so modeling, with all the uncertainties above, so to make it different than trying to anticipate what's going to happen over the next few weeks, we also have this returning to school thing, which is kind of hard to predict what the impact on the overall numbers of hospitalizations will be, but I don't think it's going to be a positive impact, but I hope it's not going to be a significant impact. But with all these uncertainties, if you look at states to the south of us, what's happened, they have generally started turning over their peak. And so especially if you pull out Missouri and Arkansas, which went through severe peaks over the last month or so, from the time they start seeing increasing cases to the time that they hit their peak is really interestingly consistent, around 40 to 44 days. So we started to have an uptick in our cases in Linn County towards the end of July. That would suggest that for the next week and a half or so, we're going to have increasing cases, and then we'll reach a peak sometime in early September. The reason why I bring that up is because this is not just automatically going to happen. Even in these other states where even if you don't have a mask mandate, even if you don't, shut down things, which I'm not advocating that we shut down things, people respond. The majority of people respond to suggestions or recommendations from public health that we tighten up on our mitigation. In order for us to see that peak in early September, which is what I hope, if not sooner, we have to tighten up. We have to start mitigating. We have to start doing all the things that I'm sure Heather will go over very well in her mom voice in a few minutes. We need to start doing the thing in the car where I squirt my hand with sanitizer and do the steering wheel thing again. We need to put the mask back on. We need to avoid gatherings, and we need to stay home when we're sick. We need to do all of that. And please, please, please get vaccinated. So that's all I have, and I'll turn it over to Heather.
Thank you, Dr. Meyer. So good afternoon. My name is Heather Metter, and I am the Clinical Services Supervisor at Linn County Public Health. As has been stated several times today, vaccination remains the most effective tool to combat COVID-19. And while cases are increasing, please continue to wear a mask, social distance, and stay home when sick. Since May, COVID-19 vaccines have been available to all individuals 12 and older, and I encourage everyone who is eligible to get vaccinated to get the vaccine. The authorized COVID-19 vaccines continue to effectively reduce the risk of severe disease, hospitalization, and death, even against the highly prevalent Delta variant. Yesterday, the FDA announced full approval of the Pfizer vaccine for individuals 16 years and older. The emergency use authorization is still in place for 12 to 15-year-old youth. In recent weeks, information about additional booster doses of the mRNA vaccines, Pfizer and Moderna, for the general population have been announced. Currently, the CDC recommends moderately to severely immunocompromised people receive an additional dose of the COVID-19 vaccine. Studies show some immunocompromised people don't always build the same level of immunity after vaccination the way non-immunocompromised people do. And vaccination may benefit if they have an additional dose to ensure adequate protection against COVID-19. Individuals can self-attest and receive the additional dose wherever vaccines are offered. Last week, Health and Human Services, Public Health, and medical experts released a joint statement on the plan for COVID-19 boosters for all Americans beginning the week of September 20th of this year. Scientists continue to study data to understand how long vaccine protection lasts. People who are at higher risk or were vaccinated during the earlier phases of the vaccine rollout might need a booster dose to continue to have the maximum protection that the vaccine provides. Evidence has shown that over time, vaccines provide less protection against mild and moderate COVID-19 disease in certain populations. Data continues to be collected and analyzed by health experts to determine the vaccine effectiveness over time. Testing for COVID-19 is an important tool in preventing the spread of the virus. Individuals have several options for getting tested. Free at-home COVID-19 testing kits are available for pickup at Linn County Public Health from 8 a.m. to 4:30 p.m., Monday through Friday. Test kits can also be ordered and sent directly to your residence from the Test Iowa website. Completed kits can be shipped by UPS to the State Hygienic Lab. They can be dropped off at Linn County Public Health for delivery to the State Hygienic Lab, or dropped off directly to the State Hygienic Lab at 2490 Cross Park Road in Coralville. Other testing options, including the rapid COVID-19 testing, are available within the community from healthcare providers and pharmacies. Rapid COVID-19 tests are not available at Linn County Public Health. For more information on free at-home COVID-19 testing kits and additional testing options, please visit the Linn County Public Health COVID-19 testing webpage. As was stated previously, COVID-19 cases are increasing in Linn County and across the state and nation. Linn County is in a high transmission or red area as defined by the CDC. In areas with substantial or high transmission, the CDC recommends that everyone, including fully vaccinated individuals, wear a mask in public indoor settings to help prevent the spread of the virus, particularly the highly contagious Delta variant. Additionally, to assist with timely contact tracing, Linn County residents who have received a positive COVID-19 test result can complete the COVID-19 investigation form online by going to linncounty.org/COVID-19 and clicking on contact tracing. As a reminder, if you have tested positive for COVID-19, you should still follow isolation guidelines. If you have come into contact with someone that has COVID-19, you should follow the quarantine guidelines. We know our community wants to do the right thing. We want our communities healthy, and we don't want our healthcare facilities to get overwhelmed, as they are an important community resource for all of us. We want there to be healthcare professionals and hospital beds available to us, to our loved ones, to our community when we need them. We need our healthcare infrastructure ready for all patients in need of care, not just the COVID-19 patients. Please continue to do your part to prevent the spread of COVID-19. Thank you.
Okay, thanks, Heather. Appreciate that. I'm Sarah Carrizo from Unity Point Health, St. Luke's Hospital in the Communications Department. At this point, we'd like to open the floor to journalists. If you have a question, please consider addressing it specifically to each panelist, or you can drop a question in the chat and I'll take a look at that. So with that, if anyone has any questions, please go ahead and ask.
Hi, good afternoon. Thanks for taking questions. I have a question for the hospitals. Are you guys seeing any breakthrough cases at all with your staff?
Yes, we have seen employees that were previously vaccinated that then are now testing positive. Correct, Michaela?
And the only thing I would add to that is that for the most part, what you're seeing, and you see this in the hospitalized patients that are vaccinated too, for the most part, it requires a pretty intense exposure. I agree that, the Delta is a game changer and it requires less exposure in general. But if you're vaccinated, for the most part, it requires a pretty intense exposure. You're seeing most of the people, either the healthcare workers or the people that are admitted, have a family member or we're at a prolonged indoor gathering with multiple people. So that, again, the vaccine helps, but if you have enough of an exposure without doing appropriate mitigation, then you're at risk to get it.
Yes, household contacts seem to be common and big, yeah.
I see there's a question in the chat from Nicole AG from Channel 9 for public health. So Heather or Pramod, do you believe that the full approval will make a difference in hesitancy?
So we don't know how much that would really help us with regard to hesitancy, but at least this truly provides another assurance to our neighbors that it's really very safe and effective. So that would be helpful. But Heather, do you want to say something to that?
No, I would agree. We'll wait and see if that increases our vaccination rates. But again, it's showing gold standard best practice that the Pfizer vaccine has met that full approval. So it is a safe and effective vaccine. And again, we highly encourage vaccination for anyone that is eligible to receive the vaccine.
There's a follow-up to that question also from Nicole for public health. Could you explain how the relationship will work with local school districts when it comes to contact tracing this year?
I'll let Heather talk about that.
So what we will be doing is we will be following up with all of our positive cases like we have been doing. Again, we encourage residents to go online and complete the online assessment tool because we are seeing more and more cases. So it's harder and harder to get everyone contacted right away. So please fill that out. When we find out that there is a student or staff member at the school, we will contact the school to let them know that there is a positive staff member, a positive student with COVID-19. And then we have provided letters that the schools can send out then to the parents in the classrooms or parents with an activity within the schools so that parents have that opportunity to make an informed decision on what they should do when they have a student that may be exposed to someone that's positive.
Any more questions from the journalists attending?
I might have a follow-up to that if I may.
Go ahead.
Okay, thank you. Just curious if you could explain a little bit more, Heather. I think this was kind of alluded to earlier on in the press conference, but what concerns do you have as we return to in-person school and as colleges in the county begin in-person classes too? As we're seeing this trend, what concerns do you have around those activities resuming?
Yeah. Pramod, would you like to take that question?
Go ahead.
Okay. So we're always concerned about the spread of infection, and that's why, as has been stated earlier, it's really good to have that layered approach. It's not just one thing. It's not the vaccine all by itself. It's not wearing a mask all by itself. It's that layered approach. So if we can all come together, just as Dr. Myers and Dr. Arnold had stated before, we did this before, and as a community coming together to do these layered approaches and working together, we were able to get through last November, and we don't want to see a repeat of that. So it's those layered approaches. So if we can work together, if we can do the vaccine, which we know is so beneficial, and that's what's going to help us to get through this, but it's also wearing a mask and social distancing, washing your hands. And so importantly, if you are ill, please stay home. And this is so important for the schools and for the colleges. We hear over and over, well, I thought it was just a cold. I thought it was just an allergy. But if you have any signs of illness, please stay home. We do have the test kits here. You can have test kits mailed to your home. So, get tested. But if you have any signs of illness, please stay home.
And all these layered mitigation strategies that Heather is talking about, they're all evidence-based. They are all proven to be effective. So, and the scientists have worked on this for some time, and they are recommending that we should implement those strategies in order to beat this virus.
Thanks. David with CBS2 has a question for the public health system. He asks, how much would at-home or virtual help with school districts? He goes on to say, I spent yesterday with the Linn school district. I'm told the Delta variant rise and FDA approval of Pfizer vaccine will not change the return to learn plan. So I think that's more to Heather or Pramod.
Pramod?
Go ahead.
So what we know is that students learn best in school. And I think the community as a whole, we want our children in school to learn. Social, emotional, and productivity of what they'll be learning is much better in the schools. And our schools, we know so much more than what we did last year. We've learned a lot over the past year. We're in a different place now than when we were last year. The Delta variant does change the game. However, we're in a much better place, and schools were able to practice a lot of this last year already. So they know how to help with that social distancing, how to encourage mask use, how to work with parents to make sure kids are staying home when ill. So I think it's schools working with their families, with their students, with their staff members to, again, do all those layered approaches and to work together to keep those students as healthy as possible. But again, I think the goal is to keep students in school. We don't want to see schools have to close. We don't want to go back to virtual learning. I think we can all agree that students should be in the classroom.
Any more questions from our journalists?
I think there was one question from Nicole.
I already answered it.
Oh,
21 we had at St. Luke's today.
Okay.
Dr. Myers, Dr. Arnold, did you have anything to say about the going back to school too, or anything that you'd like to add with the pediatric populations that you're seeing? So I don't know if you wanted to add anything to that too or not.
I think that, I mean, the concern that I have, I'm kind of agnostic when it comes to children wearing masks because I just don't think they wear them correctly. All right. And I made that point before. But I think when you have RSV, we don't know what influenza is going to do this year. It was absent last year, which was a blessing, and schools. So they have to go back to school. They learn better in person. And the vaccine is there for down to at least 16. And that's my encouragement on that. So it is a potential to be a significant concern, and we will be prepared for it. And I think the vaccine and diligent mitigation strategies will minimize or at least attempt to minimize the potential for it being a huge problem. I don't know, Tony, if you had anything to add.
No, I agree with, I mean, I think some kids can wear masks well, and I wouldn't, if they want to wear them, I would encourage it.
Absolutely, yeah. I mean,
yeah, otherwise, yeah, I think the schools doing their, spacing and things will be effective, decreasing some of the gatherings. There's other things, like Heather was saying, there's a bunch of other things that they can do. I think we get focused sometimes on one particular thing, and then there's lots of conversation about that when really it's just about the entire effort. And please keep your kids home when they're sick.
Yeah, absolutely.
Okay. If we have no more questions from our journalists, well, we thank everyone for joining us today, and we will conclude the news conference.
Someone got here late, Sarah.
Oh, I apologize.
White.
Thanks for noticing that. It is Michelle White, actually from Channel 7. She indicated we may have covered this, but do you know for sure any increases attributed to the Delta variant, and a recap of those numbers? Also, what about the psychological effects on kids wearing masks? I'm not sure who wants to field that.
I can take the Delta variant. I mean, I think the Delta variant is solely responsible. I know Pramod said 80%, but the Cedar Rapids Water Department does wastewater testing on the presence of the virus in the community. It's 100% Delta. There's no Alpha. And so I do think the Delta is the reason that we've seen these spikes, particularly in the unvaccinated. And I don't have the expertise to tell you the psychological effects of kids wearing masks. I know I've practiced that where I just pretend I know everyone that I'm seeing in the hallway, because with the mask, I don't know who it is for sure. So if I wave to you and act like I'm happy to see it, because I'm not sure I can recognize you. So makes me friendlier, I guess.
And she asked specifically about Delta case numbers.
We wouldn't know that. We'd presume it's a significant majority that can be tested through the state hygienic lab, but the turnaround time just is not clinically impactful, and it doesn't change how we're treating it.
Yeah, we're working under the presumption that all of them are Delta.
That's my feeling. I believe that.
Yeah.
Okay, I think perhaps that is all the questions. Thanks everyone very much for joining us today and taking the time. We appreciate it. And that will conclude our news conference today.